Hello everybody, I'm going to start out with discussing what medication compliance and non-compliance is, and then we will move towards some of the reasons for non-compliance and the risk involved with non-compliance, as well as strategies for addressing non-compliance with clients. So the first one, so non-compliance is pretty much not sticking with what your doctor prescribes you for your medications. So as an example, somebody might go off their medications for some time. They might withdraw, or they might choose to just basically take more medications because they believe that it might help them more, or they might try to reduce their medications. They might try to combine it with other herbal remedies and do other things that the doctor might not know about. And pretty much what this does is it causes a lot of complications. The doctor already has prescribed medications, scientifically researched, considering the DNA, chemistry, body structure, and all of those things. So when an individual ends up not complying with the doctor's orders, then there could be various adverse reactions that take place. And then second of all, some reasons for non-compliance is that the client may not trust what the medical doctor has to say. So as an example, somebody might believe that they can wing it, or they can get off meds without the medical doctor, and they might experience different adverse reactions from that too, instead of finding a way to taper off, or just to follow what the doctor says, because ultimately if the psychiatric board and the psychiatrist are doing what they're supposed to be doing ethically, and also working in the mental health counseling field of providing referrals, it is essential that there's different regulation boards that are followed. Pharmaceuticals, drug companies, different things like that have various research, and for an individual to basically not comply, that can cause a lot of reactions, and people might do it because they feel not very motivated to take their medications, or they just might feel depressed, or cultural reasons as well too. Some people might believe more in taking herbal remedies, but unless we really know what those reactions would be within the body, sometimes it's hard to tell what those situations might be, or the outcomes might be for that individual. And the third one is the risks involved with non-compliance. There's definitely quite a few. One of the risks might be if somebody doesn't take blood pressure medication, then they could have a higher risk of blood pressure, of basically their blood pressure going up, cardiac disease. There could be different physical symptoms, that might occur from, not taking certain types of medications. So it's, really important. Also, memory functioning, that could decrease, psychological ability, being able to have more, hand-eye coordination, all the, physical and psychological elements involved. And then fourth one, strategies for addressing non-compliance. I would say just, being really open with the client. The thing is that we don't always know what the client's situation is. There could be a number of reasons for not adhering to medication regimen. So it's important to maybe ask the client, why haven't they showed up for the past few months, or what are some concerns that they might have, and then just basically go from there. Also, some self-efficacy exercises, thinking about it from a holistic perspective, and focusing on a medical regimen integrated with whole person care, so also providing various therapeutic interventions to address the client's level of care. So that's what I have in regards to medication compliance and why some people might not be compliant, and the reason why it's so important to adhere to an ethical doctor's medical regimen. Thank you.